How to know if you have ADHD. If you struggle to focus on tasks, stay organized, and manage your time, you might wonder, do I have ADHD or is this something else? ADHD, or attention deficit hyperactivity disorder, can make it harder to focus your attention and control your impulses. But ADHD isn't the only condition that can cause these symptoms. So, how can you tell if your symptoms are due to ADHD? What warning signs should you look for, and what treatment options do you have? Hi there, I'm Melissa Hummelt, LPCC, and today I'm here with BetterHelp to talk to you about ADHD. In this video, we'll be exploring some key symptoms to watch for that may be signs of ADHD. We'll also talk about how ADHD is treated, as well as some strategies for managing symptoms. Let's get started. What is ADHD? According to the National Institute of Mental Health, around 11% of children and around 4% of adults live with ADHD. ADHD is a neurodevelopmental disorder, meaning it affects the way the brain develops. ADHD causes symptoms like inattentiveness, impulsiveness, and hyperactivity. These symptoms can make it hard to focus, control your impulses, and stay on top of responsibilities. As a result, people with ADHD often struggle at work, at school, and in relationships. There's a common misconception that people with ADHD are just lazy or irresponsible, but ADHD isn't just a lack of willpower and discipline. When you have ADHD, it can feel almost impossible to meet deadlines, stay organized, and complete tasks. This is due to something called executive dysfunction. Executive functioning is the brain's ability to manage time, direct attention, handle distractions, and control urges. People with executive dysfunction struggle with these cognitive skills due to the differences in how their brains work. This can make things like meeting deadlines and concentrating on projects feel overwhelming or even exhausting. ADHD is more than just feeling restless once in a while or occasionally being unmotivated to do work. While these can be symptoms of ADHD, they aren't always. In fact, there's a wide range of mental illnesses that can cause symptoms similar to ADHD. Anxiety and depression are two common examples. In a moment, we'll explore some of the most common signs of ADHD. But first, don't forget to give this video a thumbs up, subscribe to our channel, and turn on notifications so you don't miss out on future videos. Do I have ADHD? When you're struggling with motivation, organization, or impulsiveness, you might wonder, do I have ADHD or am I just lazy? To help you understand what sets ADHD apart, let's explore some of its key features. Again, keep in mind that these symptoms can overlap with other mental illnesses. That's why if you think you might have ADHD, it can be important to seek a professional diagnosis. That said, common signs and symptoms of ADHD include behavior patterns, cognitive aspects, and emotional aspects. Let's talk through behavior patterns. It can be natural to miss a meeting, forget to send an email, or procrastinate once in a while. But people with ADHD tend to struggle consistently with impulsiveness, forgetfulness, and lack of motivation. When you have ADHD, you might struggle every day to get started on your work and finish tasks on time. You might frequently lose track of items or forget important things on your to-do list. It can also be common for people with ADHD to make frequent mistakes on schoolwork and work projects, or engage in high-risk behaviors like reckless driving or unsafe sex. Now let's look at the cognitive aspects. As we discussed earlier, ADHD affects executive functioning. People with ADHD often have trouble sitting still, controlling their impulses, remembering dates, times, and events, getting started on tasks, following deadlines, and more. These struggles can make it harder for people with ADHD to stay on top of their daily lives and responsibilities. Finally, there are emotional aspects. People with ADHD often struggle to manage their emotions. When you have ADHD, it can be common to lose patience or get easily frustrated. You might find yourself having mood swings or overreacting to events. It can also be common for people with ADHD to feel intense guilt or frustration about their struggles at work or school. How is ADHD diagnosed and treated? So what should you do if you've noticed symptoms of ADHD? You might want to start by seeking professional support. If you aren't sure where to turn, consider talking to your primary healthcare provider. They may be able to give you some clarity on what's causing your symptoms. They may also refer you to a mental health professional who specializes in diagnosing ADHD. If you've been diagnosed with ADHD, you may wonder about your treatment options. If your mental health care provider believes it's the right fit, They may prescribe you a stimulant or non-stimulant medication to help you manage your symptoms. They may also recommend seeking therapy. Cognitive behavioral therapy, or CBT, aims to help patients change the thoughts and beliefs that are contributing to their symptoms. However, there are many other types of therapy besides CBT that may be helpful for people with ADHD. As you can see, there are a lot of ADHD treatments out there. Your healthcare provider may be able to recommend the right one for you. What are other tips for managing ADHD? But beyond professional treatment, what else can you do to make living with ADHD easier? To start off, it can be helpful to break large tasks into smaller, more manageable goals. This may make it easier to get started on complex tasks. For example, instead of thinking, I have to write a full report for my job, you could start by telling yourself, I'm just going to write the first section of the report, then I can stop if I want. This makes it less overwhelming to get started on the task, and you may find that it's easier to keep going once you've done the first small piece. Getting organized can help too. Consider using a calendar to manage your deadlines and to-dos. You can also try breaking your workday into time blocks and setting an alarm to remind yourself when it's time to change tasks. Although there's no one-size-fits-all strategy, experimenting with your routines and habits can help you build a more productive system. Various studies have also found that other lifestyle changes like getting regular exercise may help reduce ADHD symptoms. And don't underestimate the power of good sleep hygiene. Try to avoid using screens for around 30 minutes to an hour before you go to sleep. Keep your bedroom quiet and dark, and avoid using caffeine in the afternoon. Finally, think about getting outside support. Managing ADHD can be hard, but having someone to talk to may make it easier to build healthy habits. Consider talking to a licensed therapist for more tailored advice, self-care tips, and ADHD management strategies. ADHD is more than just laziness. It's a pattern of challenges with attention, impulsiveness, and hyperactivity that can affect all aspects of life. If you think you might have ADHD, talking to a professional is often the first step to getting the support you need. The right treatment and lifestyle changes can often make a big difference in your symptoms and quality of life. If you liked this video, remember to subscribe to the BetterHelp YouTube channel. And be sure to turn on notifications so you don't miss future mental health information. Until next time,